the partners that we have enlisted in this campaign to ensure that we reduce, if not eliminate, the theft of medicines and other medical supplies from government health facilities, which are meant to be received free of charge by the patients that go to those government health facilities. We have said, and we have informed Ugandans through you, that government provides a budget for procurement of essential medicines and medical supplies, and these essential medical supplies and medicines are bought and delivered to all government health facilities. We have also, and we want to inform Ugandans that in addition to the budget that government of Uganda provides through the appropriation, the members of parliament, we also have a significant amount of medicines and health supplies that our development partners or donors give us in kind, and those are additional to the quantities that government of Uganda buys. And all these are delivered to government health facilities. The budget for the procurement and delivery of these medicines has increased significantly over the years, and we therefore would not want that the people who have paid their taxes, either the Ugandans or our partners who have provided the supplies, again from the money that is given to them by their taxpayers, does not give us the intended benefit, which benefit is that the Ugandans who go to these government health facilities are able to receive these medicines and health supplies that are meant for them free of charge. Government has embossed these medicines and health supplies to the extent possible. Government has put in place a system that monitors and ensures that all the medicines and health supplies that leave national medical stores reach the intended beneficiary. We can monitor and we can confirm. And some of these tools are available to you, that you can, in the comfort of your seat today, or in your offices, or wherever you are in your homes, be able to have information on when these medicines and health supplies were delivered and were received, and probably who actually received these supplies. And therefore, the wananchi should be able to access these medicines that we deliver to these health facilities free of charge. Dr. Warren Namara of the Health Monitoring Unit talked about Ugandans who stampede our health facilities. We only need patients at our health facilities to benefit from these medicines. We do not want neighbors who receive calls or who see the truck of NMS delivering these medicines and rush to get their share. Medicines are not a ration that you have a share if you are not a patient. It does not matter, and you should not complain as a Ugandan that God has been so gracious to you and you have not fallen sick, and therefore you ask who took your share of the medicines. Just be patient, because today it's me, tomorrow when I am okay, it will be you who will need those medicines. So the wananchi should not just rush to the government health facilities to pick the medicines if they do not need them, that is, if they are not sick and need a solution from the health facilities. We have got reassurance, and we would want you to help us inform the wananchi that police is on standby to help us within the structures that they have, and all the other security forces are on standby to help us to get these people and bring them before the courts of law so that they can receive their due punishment. The challenge that we've been having, as we heard from the Director General of Health Services, is that some of the penalties, actually not some, all the penalties that we currently have are so lenient. You get somebody with medicines worth 200 million, you secure a conviction in courts of law, and they get this person and ask them to pay a fine of not more than 5 million. So even if they give them the maximum of 5 million, it will not be proportionate to the medicines or the value of the medicines that they will have attempted or they will have been found with. We need stringent penalties, and it is because of that that the Ministry of Health has tabled amendments, which you have seen and you have reported about. If these are passed by the Parliament of Uganda, as we expect, they should go a long way to dealing with this problem. We also need probably more innovations in those penalties, that we should not only state that they should be just up to 100 million. It should be somebody to pay at least 3 times the value of the medicines and health supplies they find you with. Because if you put it at 100 and somebody steals medicines and supplies, as you've heard from Health Monitoring Unit Director, of more than $1 billion, somebody can still pay 100 million and walk away. That punishment should be tied to the value of the medicines or the 100 million, whichever is greater. So if they find me with medicines of 1 billion, I should not just pay 100 million and go away. I should be able to pay 3 times, which is 3 billion. And if they find me with medicines of 5 million, then the 100 million becomes a higher penalty. So that is what we would want to see in the amendments, and we would want to urge you and the people who are going to make presentations, the Committee of Parliament, the Health Committee of Parliament that is discussing this bill, to make sure that you will make this difficult. Not only the one who they have found with medicines, as the police public relations officer has said, even the people that have been keeping these medicines or storing them, even the vehicle, the conveyance, if they find medicines conveyed in a bus, either the bus should be able to pay this penalty, or in some other countries, they actually confiscate the means of distribution or conveyance they find you with. If they find you with medicines stolen, they will also confiscate your bus or the lorry, and they will auction it, and it becomes government property. So some of these punishments would go a long way in helping us deal with this issue. We have heard of the electronic medical records, which the Director General of Health Services has informed us about. That is the IT system that ensures that it talks to the system of NMS. Currently, our system is from NMS up to the time we hand over these medicines at the health facility. Once we hand over to the in-charges, we do not have a way of knowing what has happened in the system. Now, the Ministry of Health has come up with this innovation, which is going to be put in all the government health facilities, so that once the medicines have been received, we have a system of knowing who actually received the medicines that were earlier received by the in-charge. Who is that mother who received the mama kits that NMS delivered at the government health facilities? What we currently have is people telling us the mama kits are not enough. Yes, they will not be enough. Probably they may never be enough. But what we want is who took the 100, the 200, the 1,000 mama kits that we delivered to this government health facility, so that we know. We look at the mothers who delivered that month. We also look at the mama kits which we have, and then we can know that yes, government brought 100 mama kits, but 120 mothers delivered. So it is the 100 mothers that got and the 20 did not get. We want this information to be there. But now what is currently happening is that you deliver 100 mama kits, no mother receives the mama kit, but all you are being told is that the mama kits you delivered were not enough. We want a system that allows us to follow up and know. This is just the mama kit. You will always find this at the government health facilities, up the health center 3, because those are the ones accredited by government to be able to receive, to be able to deliver our mothers. As you can see, that pack itself is sealed and it has government of Uganda not for sale. So it should be, somebody should be able to see it. You have this is cotton wool, which is supposed to be, you always hear when mothers are going to deliver, they are asked by cotton. So this is the cotton wool. It is very squeezed, but that is the cotton wool that they use. You will have what they call chivera. They tell the mothers, rete chivera. So this is the Macintosh for the mother, so that when you are on that delivery bed or when you are in your labor suit, they first put it there so that you do not make the other parts of the bed very dirty. This one is the kavera or the chivera for the baby, because sometimes, yes, when the baby comes out, you also need to put them in a different place. The same thing has gauze. They will ask you to buy this cotton wool and gauze because the mothers need, most of the mothers in our places, in those lower facilities, use this one for padding. So they need the gauze to wrap around the cotton wool and use it for padding, so that if they have any fluids coming out of them, this padding, these fluids should be able to be absorbed. They always ask our mothers to get surgical gloves. Each mama kit has 5 pairs of surgical gloves. It is very rare that somebody, the person helping our mother to deliver, will need more than 5 pairs of gloves. In most cases, they need 3 or 4 pairs of surgical gloves. We also have this. This is when the mother comes, we should be able to bathe the mother, rather the kid, and keep them. This is it. This is the soap that you will always find in this area. We also have the razor blade and the umbilical tape, which is there to cut and make sure that we are able to tie the umbilical cord. So these are the basic things that are found in the mama kits. And these mama kits are available at the health facilities. All government health facilities where mothers deliver, health center 3 and above. The challenge is you are always telling the wananchi that these mama kits are there. You are always telling them. You are the ones telling the wananchi that the medicines are not there. No wonder the wananchi believe that these medicines are not there, that these mama kits are not there. And that is the challenge that we are having. So we believe that from today, you will give the correct message. That government provides the budget, and that budget procures and delivers these commodities to the government health facilities. Number 2, that the partners provide medicines and health supplies, and these ones are also delivered to the health facilities in addition to what government has provided. That some of these supplies may not be enough, but we cannot know truly how much more we need if the tap is leaking. Let us first close the tap and we stop the leakage of this water, of these commodities, so that then we can know when all these Ugandans start receiving these supplies the way they are supposed to receive, how many more would not have received, so that we can now appropriately budget for them. But for us to keep saying there are no medicines in government health facility, and then when NMS actually delays to deliver these commodities, the same people are in the papers saying NMS has delayed to deliver these supplies and that's why they are not there. But in the first case, you said we don't deliver these supplies. So let us give the correct message to the wananchi. That is what we are asking of you. Let us give the correct message to the wananchi. Let the wananchi go and benefit from these commodities. Let us now know the people who are in the habit of diverting these commodities from the people who are supposed to receive them free of charge, and either selling them to these patients within the hospital or taking them outside of the hospital into their private facilities. But we also hear they are also sold in the neighboring countries. So we need to stop that and stop it now, because Ugandans cannot continue not benefiting from their taxes the way it is currently. I would like to thank you very much for listening to me. And the DMT, yes, I'm being reminded, any one of you, if you have your smartphone, you just go to Google, put in dmt.nms, dmt.nms. Are you there?
It's not upstairs.
Yeah. Just Google. This is available for every Ugandan. dmt.nms. Are we there? I don't know whether we are together. dmt.nms. And there you should be able to see NMS dispatches. You should be able to see the NMS deliveries. You should be able to see LMD deliveries. Those are last mile deliveries. That means that the delivery to the individual health facility. When you click at DMS, you will see something like this. Are you there?
Are we there?
Are we there? Yes. So once you are there, you'll be able to see dispatches from NMS. That is the medicines that we have sent. You will be able to see NMS deliveries. That is when we deliver to the DHO's office. Then you will be able to see LMD deliveries. That is when we pick them from where we have delivered them at the DHO's office and we deliver them to the individual facilities. So if you click, for example, on LMD deliveries, just tap on NMS deliveries and you go down, you will be able to see where we delivered on 27th. That was the last delivery that we made to the individual health facilities. 27th of this month, the district was Moroto, and you will be able to see the individual health facilities that we delivered to. And you can also go across and see the in charge of the facility who received these medicines. And if you continue across, you'll see that this message was copied to the DHO of Moroto district, the RDC, the CAO, the MPs, and the in charges. If it is ongoing, we should also be able to indicate that. And the same thing, if you want to know where we have delivered this morning or which vehicles we dispatched this morning, you can also click and get to know. So this is something the Wananchi can make use of, to know that the medicines have been delivered, and to go and ask, because you are free to go and ask more details from the people who will have received these medicines. Thank you very much. Is there any questions? Are there any questions? Much. I will start with the person who said that this campaign will not succeed. I can assure you it will. So relax, it will succeed, because Ugandans want medicines and they want information that these medicines have been received. And we believe that if you convey this information that we have shared with you, this campaign will succeed. On the expired medicines, we heard from the director HMU, but we know that medicines, like anything that has an expiry date, some of that will expire. And that is why you go to supermarkets, those are not medicines. You will find some things which have expired. And they expire because they have expiry date. The challenge, the issue that we would be addressing here is the quantity that has expired. That is the only concern. So the formula that is there worldwide for the information of my brother and everybody who would want to know, is that if the value of the medicines that you have, that you turn out every financial year, if the value of not more than 5% expires, you are within allowable limits. Meaning that 95% of what you receive, not less than 95% of what you receive, will be utilized. You are still there within the allowable limits. And that is all over the world. It is not just here. So, if the medicines have expired, the question will be which medicines expired. And some of these issues have been asked, and we have responded to them. The Auditor General has asked the same question before and was clear and stated it exactly why these medicines expired. You come to the warehouse of NMS and the medicines expire. Which medicines expired in NMS last financial year? COVID vaccines, COVID test kits, ARVs, which are the old type that was no longer effective. What would you want us to do with that? If COVID vaccines come and by God's grace COVID goes, what do you want us to do with the COVID vaccine? We cannot use it for malaria. We cannot use it for anything else. It is not medicine that is wide range, that you have a painkiller. If the pain is not for malaria, you can use paracetamol for any other fever. This is specific for a disease. If it is not utilized, it will expire, and we have a responsibility to safely dispose it off. So if we dispose it off the way we did, we are well within our limits, and Ugandans should thank us that we had brought these COVID vaccines in the event that COVID had not gone. But we thank God that it went before all of it was utilized, and therefore we had to incinerate it. How much budget does government give us? This financial year we have 717 billion, which government has given us. And if we can tell you that this budget started rising, if you look at more than 10 years ago, at one time NMS's budget was 60 billion for the whole financial year. Around 2009-2010 financial year, 60 billion. And that included the medicine for government of Uganda, but also the budget for the development partners. Put together, it was 60 billion. Last financial year, to give you an indication of how it was increased, if you put together the 717 that government gave us, plus the one of development partners, NMS last financial year delivered medicines and health supplies worth 1.5 trillion Uganda shillings. That is how much it has been increasing, my brother. So, on the delivery schedule, we have a delivery schedule, and NMS delivers once every 2 months. Once every 2 months, and that is what we call cycle. So when you look at our DMT and you see cycle, that is delivery for 2 months. That is why we have 6 cycles. So you will see cycle 1, 2, 3, 4, up to 6, because we deliver in the 12 months, we deliver 6 cycles because we deliver once every 2 months to the regional referral hospitals, up to lower in the health center too. But for Mulago, the national referral hospitals, we deliver to them once every month, because for them they do not have enough store to keep all the medicines that we'll be delivering to them, all the 2 months stock. Mama kits, whether they are there or not, we have given you the information, and it is a fact. So go to the health facilities, ask them about the last delivery that we made to them. You will be able to see Mama Kit as one of the items that we delivered those health facilities. So it is not just that we are saying, it is a fact that we deliver these Mama Kit. Why the mothers are not receiving them, that's why we are here. That's why we are here. Because I think a few years ago, there were about 3 or 4 years, when His Excellency the President visited, was it Nakauka Health Center 3? You reported widely about it. When we went there with him, and the mothers we found in the maternity ward did not, they had been told to go and buy these beveras, they had been told to buy the gloves, they had been told to buy cotton wool. But when we went in their store, we found 55 Mama Kits that NMS had previously delivered 3 weeks prior to that, still locked up. And these mothers who were being attended to had not received them. That is why we are giving you the information. Why? Because you have been going around telling people that these Mama Kits are not there. We are telling you that they are there. If they knew that they were there and they demanded for them, they would be given. But if you continue telling them that they are not there, then they will continue locking them in the stores and selling, opening these veras and selling the individual components of these markets to them. Security system, yes, the security system is there. And that is why we told you that our work as NMS ends when these medicines and health supplies are received by the in-charges of the health facility. After that, our trucks come back and the NMS's work is done. What has been missing is that once these items are delivered, how do they then reach the patient? That is the system that we have not been having in the country. And that is the system that now government has decided to put in place, and you heard about it. They are called electronic medical records, and they are the ones that will be able to tell you that Kamaware went to Mulago Hospital today and got TB medicines. That if I go now from Mulago and I want to go to Entebbe Hospital to get the same TB medicines, they will say thank you very much. As from the system, we can see that you got your TB dose from Mulago Hospital, and therefore you should not be able to receive it. Why? Because we had seen a system in this country. There are unscrupulous people in town here whose work it is to just collect medicines from different health facilities, especially ARVs, TB medicines, and antimalarials. They just go, they get a patient who actually tests positive. They go to one health facility, they test them, they give them a dose of Coartem. They move with them to the second health facility, they do the test, they are again positive, they give them the... By the end of the day, they have collected 20 doses of antimalarial, and that's what they do for a living here. We have seen the same thing for HIV patients. They go and enlist themselves in about 10 health centers around town. So they will pick from Chirudu, go and pick from Mulago, go to Nsambi and pick, go to Mengo and pick the same patient. Why? Because our systems are not talking to each other. So now government has said, let us first test them within the health facility, and the second step will be to make them talk to each other, so that if you have picked these medicines from one area, you cannot go in any other part of the country and will receive these medicines. For my sister who was talking about a specific type of medicine, I couldn't clearly understand what that type of medicine is. We will get to you and see which is that a trade name, because it doesn't sound like it is the drug name. It could be the business name of that medicine. So Sheila is going to get to you, and we see whether it is part of the medicines that we deliver. Yes. Sheila is going to come to you, and then we'll confirm whether it is among the types of medicines that we deliver to government health facilities. Sheila, there is another lot, I think, because we had that... oh, sorry. EDHMU.